All right, so we are at 1:30 and it seems like most of the folks have joined us. So I will get going and then we'll just kind of jump into things and people can continue to join us over the next couple minutes, but we do have a tight 60-minute agenda, so we'll get going. So first off, I want to welcome you and thank you for attending our session on Going Virtual with Diabetes Education in BC. So I'd like to begin with a territorial acknowledgement. And just a reminder for the panelists, if you can mute your lines if you're not speaking, that would be great. Thank you. So I'd like to begin by acknowledging the respective land on which we virtually gather today. I'm located in Kelowna, BC, so I want to express my gratitude and acknowledge that I work within the ancestral, traditional, and unceded territory of the Syilx Nation. So we're going to start off with some introductions. My name is Raman Bowerbank. I work with the BC Patient Safety and Quality Council as a leader of health system improvement. My team and I are going to be hosting. You'll hear a lot of my voice today, but we're all working in the background. So my team includes Shauna, Mark, and Colleen. So I'll let them quickly introduce themselves. So I'll start with you, Shauna.
Thanks, Raman, and good afternoon, everyone. Thank you for joining, and so many of you early, too. That's awesome. So I am a project coordinator with the Health System Improvement team at the Council, and I'm here today to help with any technical difficulties should they arise, and also to help monitor the chat box.
Great. Thank you, Shauna. Mark?
Hi, everybody. It's Mark Pelche. I'm the CEO of the Institute for Health System Transformation and Sustainability. On your slide, you can see a little bit about us. The two main things that we do are palliative care. So we run the BC Center for Palliative Care. You might know about that work. And we've begun an initiative that we're going to talk about today focused on type 2 diabetes. My background is in healthcare. I've been 20 plus years in Fraser Health as an executive there. And prior to joining the IHSTS, which is the short form for my little organization. It's a non-profit organization, so I just want to make sure there's no conflict here around vendor interest or anything like that. So that's me.
Thanks, Mark. Colleen?
Hi, everyone. I'm Colleen Kennedy. I'm the Executive Director of Health System Improvement and Engagement with the Council. As Mark alluded to, we got a little summary of who we are up on the screen now for you to read. And we're just really thrilled that you could join us today, and we look forward to the conversations and hopefully moving forward together.
Wonderful. Thank you. So I'm going to just review our agenda. Our primary objective for the session today is really just to hold a space for discussion, open learning, and sharing, and that is really the objective, and that's reflected in our agenda. So we're going to start with an introduction and overview of how we got here and what the current state of virtual care is in BC. Then we get the pleasure of hearing from Interior Health on their experience with virtual care, and then the bulk of our agenda will be around a roundtable discussion, so sharing experiences, early lessons and successes, and then Colleen will summarize and let us know kind of where we've landed and next steps. So before we jump into our agenda, of course, in the spirit of virtual gatherings, we are going to get to know this tool, the platform that we're working on today. So this is WebEx, for those of you that aren't familiar. First and foremost, I'm just going to remind everyone again to mute your lines. We have automatically muted everyone for the first little bit of our session, but you will have the opportunity to mute and unmute yourself during our roundtable discussion. So the mute button can be found once you have that ability. It'll be found just to the right of your name. You could see here on the slide, I will try to point. So right here, you'll see that it'll be red when you're muted, and then you can unmute when you'd like to speak. So you'll have some practice you'll have an opportunity to practice later on in the session. Also, just a quick note, so if you do receive another call, please don't put us on hold. It's really nice and nice spa music usually, but it's kind of disruptive to the conversation. So if you could refrain from putting us on hold, that would be wonderful. So, and just a note that we are recording this session. We had a few folks that are unable to join but registered and would like to receive a recording and a summary, so just noted that. So our first tool that we are going to introduce you to, and you will be using a bit later in the session, is our pointer tool. You can find your pointer tool, your arrow, in the top left-hand corner of your screen. If you click on the arrow and then click on the screen, you will be able to, perfect, Gina's got it. You should be able to get an arrow. You guys have it. So I'm going to give you an opportunity to practice on this next slide. If you can move your arrow just by clicking in a different spot. Let us know where you're calling in from today. Awesome. Wow. Great. So everyone, I see some arrows moving and lots of overlap. So we have a good spread. Great. Thank you. Lots of folks from all over. Nancy's way up there. Great. Thank you for that. So we'll be using that a little bit later as well. Okay, so the next tool is our chat box. This is where we can say hello, and we can also ask any questions throughout the session. So it'll be an important resource for us all, especially while we're on mute. So the chat box is in the lower right-hand corner of your screen. It's fairly small by default because the participant list is up top. I will grab my pointer. So the participant list is up top. So if you would like to expand the chat box, you can just click in between participants and chat. You should see a double arrow, like a toggle, that you can expand one or the other. That should work. And if that doesn't work, if you're on like a laptop or a smaller screen, you can also access the chat by clicking the top right-hand side. There should be a bigger chat icon up there, and you can unhighlight the participants tab, and that should expand your chat as well. So there's a couple ways you can do it. If you're unable to see the chat, just let us know. You could you could raise your hand or message Shauna, the host. So when you are entering a message into the chat, you type in your chat and then you send to all participants and press send. So let's test that out and say hello and share what your role is. So I will say hello, leader, health system improvement. And we'll get to know who's on the line. Wonderful. This is great. Yeah, lots of folks. Perfect. So that will continue. Please continue to say hello and share your role in the chat. Like I said, this can be used throughout the session. So as we're talking or presenting, feel free to pop your questions or comments in there. We will be monitoring that closely. And that's the chat box. And the last tool I want to introduce you to is raising your hand. So as I mentioned, you guys are all muted right now. So if you do have something to say or you want to ask a question or anything like that, please raise your hand and Shauna will be able to unmute your line so that you can speak. And again, during the discussion, everyone will be unmuted. So that raise your hand is just located underneath the participant list, a hand up and a hand down. And that's basically it. You click it and unclick it. So we could practice that later during the discussion as well. All right, before moving on, does anyone have any questions about any of the tools? You could raise your hand or pop it into the chat. Shauna, have we Do you see any questions related to tools or WebEx?
Not yet in the chat, and I'm just scrolling for any hands and don't see any of those either.
Okay, great. Please feel free to ask along the way. We're here to help. So with that, I am going to pass it on to Mark to share how we got here and a bit about the current state of virtual care in BC.
Okay, thanks very much. So very quickly, how did we get here? So of course, COVID-19 has created unprecedented demand for virtual care right across the healthcare system, right across the world, and everybody kind of knows that, feels it every day. Of course, patients are feeling it, especially in those parts of the system that aren't an emergency department or aren't inpatient units, so specifically focused on COVID. And of course, diabetes education programs across the province and across the country are trying to make that shift onto virtual platforms. And we just thought, in the context of a larger piece of work that we were doing, that there was an opportunity here to gather online and share learnings. Not that there is a perfect solution, because everybody's almost in the same spot. Early learnings, and to see whether there's alignment, some sharing that could be facilitated between health authorities. So we go to the next slide. We've got lots of really cool things happening from our typically in a health authority via the IT departments, or if you have a virtual care office that you're lucky enough to have some people that have been focusing in on that. And very, very short period of time, they've been putting out guides and materials to support the technological aspects, mainly of video conferencing. So they've been pushing that out, and a number of the websites that are publicly facing, PHSA, Providence Healthcare, and a number of the others have articulated exactly what they are offering or how they're offering it, and mainly for an internal audience. So there's a lot of stuff happening, and I would just want to acknowledge that how quickly these folks have risen to the challenge and put out stuff that in the past has been under debate for many, many years, is now out there really fast. The other thing that's worthy of mentioning is not only in health authorities, but right across the board in physicians' offices across the province, lots has been happening in terms of uptake of video conferencing. Zoom right now for healthcare seems to be a very prominent modular or network platform that's being applied, but there's quite a few others that some of you have a lot of experience in. We're not going to go into the depth of that technology, but I just kind of flag it for you as kind of one very, very rapidly evolving resource for everybody to tap into. We might hear a little bit more about what's happening in each of the health authorities in terms of putting those resources out there. The virtual care typically goes beyond the concept of video conferencing, and it includes the most common virtual care platform, which is the telephone. And I suspect we're going to hear a lot today about really how that's the first step, that people are moving to do clinical engagement over the phone. But there's other technologies that are evolving quickly, even in the context of the COVID experience. So text messaging and email are two examples. There's others. And the one thing that's specifically related to home health monitoring is specifically related to COVID is home health monitoring. So there's a number of health authorities that are making available to people that have suspected concerns about COVID to do home health monitoring through an app. And it's one example of home health monitoring that's been around in the province for a while in the context of COPD and heart failure and so on. So I just flag it here, not for discussion in any detail today, but just to kind of round out the picture of what we're talking about when we're talking about virtual care. And just lastly, a shout out to HealthLinks BC. They're probably the biggest and longest standing telehealth provider in the province. And you probably know a lot of their numbers because they've been announced in press conferences in the last few weeks around the number of calls they're fielding every day. But if you haven't been to their website lately, I encourage you to go, because there's quite a few details there about other services that are not as well known across the province, including dietitian, pharmacists, and now physicians. So Northern Health, the Rural Coordination Center has partnered with HealthLink BC to offer a physician backup to the HealthLink nurses. So that's an example of a quickly evolving service that's mainly online. Next slide, please. And just a little bit more context. So this idea of sharing virtual experiences is perhaps only one example or one possibility for greater province-wide sharing. And last summer's Diabetes Dialogue that we hosted, the IHSTS hosted, and some of you attended, identified many opportunities for sharing. So emerging and best practices, resources, and expertise across BC, and through a network of learning, a network of people, professionals involved with diabetes. So we've cast the net quite large, but for today's session, we've just said, let's just focus on something that's really in front of us in the diabetes education community, and we've narrowed it to people focused in on health authority practices as opposed to community practices or outside of health authority practices. So that's the work, and we're going to come back towards the end. Colleen's going to talk a little bit more about community practice or the network that we're proposing and get your feedback and your ideas around that. So that's the context. Back to you.
Thanks so much, Mark. Okay, so we're going to exercise our pointer tools again and get to know your experience with virtual care, particularly in the last couple months. Have you felt like this guy or better? So what virtual care technology have you used the most in the past 2 months? Again, just grab your pointer arrow, top left corner, and let us know. Great. Yeah, interesting. So this is kind of what we heard as well, is it's telephone and video conference. Started with telephone and moved over to video conference, a few email and text message. Great. Couple people moving back and forth. Nice. Okay, great. So that's a good starting point, gives us a sense of where everyone's at, and that is great. So we're going to jump into our first presentation from Interior Health, from Melanie and Susie around virtual care in their diabetes education centers. So I will pass it on to you, Melanie.
Thanks so much. Can you hear me okay?
Yes, we can hear you great. Thanks.
Perfect. So thanks so much for having us. As you mentioned, my name is Melanie Beattie, and I'm one of the knowledge coordinators that work with chronic disease. And I work closely with my colleague and good friend, Susie Wilkinson, who's the practice lead for chronic disease and Interior Health. So together, we've been working on the virtual care guidelines for Interior Health during COVID. I'd also like to thank you guys for putting this together as the organizers. I mean, it's what a great opportunity to have shared learning and collaboration amongst the health authorities during a challenging time. So thank you so much. And also, we're joining you today, or I'm joining you today from the Felix Nation, so I'd like to give thanks and recognize that I'm working and living on the ancestral, traditional, and unceded territory of the Felix Nation. So if we go to the first slide there, the next slide. So our first action, not at all a surprise, was to switch things to virtual. So when COVID-19 started making its way into our BC population, the changes were really quick and they had to be implemented fast. And obviously we really had to take into account clinician and client safety. So both of those were playing a role. And for Interior Health, the notification came out relatively quick that all visits for our community clinics, including our diabetes education centers, should be switched to virtual wherever possible, and that our non-urgent or non-emergent visits could be postponed. And then our DEC message went a little bit further. We said no in-person visits. We're switching everything to virtual. But the question still remains, it's like the cart before the horse. We're like, but how? And so if you go to the next slide there, then that'll be great. So the plan, obvious answer, switch to the phone where you can, right? And we've already heard that. So we looked at various video conferencing options. We looked at Skype for Business and we looked at Zoom. And for Interior Health, we opted to go with the Zoom technology. So all of our DEC clinicians have an IH Zoom account. So that's not the free one, obviously, it's the licensed one that we chose for healthcare. And with that, we actually created a memo that had an attached algorithm, and this was really just to support our clinicians and our clinics in looking at the appointment that we had booked and determining, could this appointment be postponed? Should we provide it by telephone if we do need to have it, or should we use the Zoom technology? In the beginning, we were being careful with how much we put into the system as well, because there was glitches and things were crashing, right? So we were looking to go to telephone and then if needed, Zoom. So obviously the clinicians played a huge role in this. This was just a quick kind of algorithm, but clinical judgment was key to this. So who was going to be seen and for what was all left up to clinical discretion and what was going on at a local level, right? So some areas had staff being redeployed and others weren't as affected by COVID yet. So if we could move to the next. So because things were going so quickly, we actually had to circle back, no surprise there, and ensure that all of our privacy and confidentiality measures were being taken. And this resulted in 2 actions, actually. So the first was the do not reply emails. We opted to supply all of our DEC clinicians and or administrative staff with a do not reply email account. And this really allows our employees to validate the client's email, which is next, because we have to validate their email address, and I'll talk about that in a minute. And then so they could use that account and not give out their first and last name or their email address. They could just use this do not reply email and validate the email address for the client. So information and privacy said that we actually had to, and our virtual team said we actually had to verify the client's email before we could send them the Zoom visit link. So that was an added step we weren't aware of, but we implemented that later. And then we got that sort of started out, and then things shifted again, and we saw our clinics. Great news, people were able to start to work from home, which was wonderful. But it did pose this really interesting dilemma we hadn't thought of before. How do we have our clients call from the home and not disclose their personal numbers? So first thing that they looked at was Skype soft phone, and that's just the Skype business telephone option. So we had that available through IMIT, or they could choose to block their personal number. It was really up to the clinician and their manager what they wanted to do, but we wanted to ensure that they had some privacy there, that our clients didn't have their personal home numbers. As we go to the next slide there. And then we had more additions to the plan. So as I mentioned earlier, some clinics were redeploying staff, so they were being moved into screening and into supporting some of that COVID work. So there was a real pressure to look at what services we're providing and decide what's a priority and what's not a priority. And it was really around this time too, we're just realizing the pandemic isn't going to be quick. This is going to be for the long game, so we really need to take a look at what we're doing, what can be postponed and what cannot. So with the clinicians and with the team leads in the clinic, we developed priority services for our Diabetes Education Center. And it's really simple. We looked at each population of people with diabetes, so for example, pregnancy, gestational, people with type 1 diabetes, people with type 2 diabetes, and determined which ones were essential, what appointment types are essential. So for example, for our diabetes with pregnancy, all visits were essential. And then with our adults with type 2, there were some that could be deferred. So that's how we looked at that. And then again, clinical judgment was used. It doesn't replace clinical judgment, but it does help support that. The next slide, please. One more thing. So I was like a dog with a bone. I kept saying, no, we're not seeing people in person. And part of that was just fear for our clinicians. I want them to be safe. I want our clients to be safe. So we kept, I went round and around and around with people. I'm sure they were so tired of listening to me. I talked to our medical director. I talked to Susie, our practice lead. I talked to our team lead. When would we ever actually have to see someone? And, our clinicians being this great, amazing group that wants to support their clients and provide them with the best care, they came back and said, no, there's absolutely times we're going to have to see people in person and it's a priority service. So I reached out to the other health authorities, and none of us had a great answer to this at this point. It was pretty new. You know, we were having shortages with PPE. What do we do? Do we send people into the home? Do we ask them to come into the DEC? All of that. So I think it was one of the other health authorities that just said, no, you know what, we would connect with our infection prevention and control folks if it came up. So that's what I did. Went to infection prevention and control, and they worked on a solution and a process to support us. And now we have something in place that if this does indeed ever happen, we can be assured that we have a process in place that keeps the staff safe and the client safe as well. So that was the one more thing, and we did it. We got there. So the next slide, please. So then, usually we'd have this resource out at the beginning and have tons of review, and then we say, hey, this is what we're doing. But of course, because COVID came so quick and we implemented so quickly, the guidelines came out last. So here we have our guidelines after the implementation. So we developed the virtual care guidelines for DECs during COVID-19. And it's a great document. I'm a bit biased, but I think it's a wonderful document. A lot of people put a lot of time into it, and it has examples of what is appropriate for a virtual care visit in the Diabetes Education Center. You know, what do you look at for that client? How will it work? How to decide which virtual option would be the best to use? And then how do you set up that virtual visit? You know, what's the techie part? Where are the links to that? You don't have to go searching. And this includes the confidentiality piece, the consent piece, etc. And then finally, how to proceed if the visit is indeed deemed a priority and needs to be done face-to-face. That's also included. And if we can go to the next slide. We've had some great successes. This was a big learning curve, and I'm so proud of our clinicians and our team leads and our managers and just everybody in their ability to pick this up and go for it, go virtual. You know, I've heard many success stories so far about insulin starts. We're able to do that by phone. We're able to do it with the Zoom account. Pregnancy follow-ups. I was talking to one of our clinicians in a rural area just yesterday about a gal who has gestational diabetes in a rural community, and she's able to connect with her virtually. So to keep her safe, keep the risk of COVID exposure to a minimum, and keep this client within target is fantastic. The other really cool thing was the pediatric clinic. So having, you know, the pediatrician join from their office, our staff join from their offices, the nurse, the dietitian, and then the family from their home. And some people were saying that the kids really like it, so that's cool. It's always good when a kid likes something, because I'm sure they're tired of going to our peds clinics all the time. So yay, some of the kids really thought it was cool, and I think that's a win. And then finally, classes. One of our clinics in Kelowna was able to do classes, and I'm not sure if Katie's on. I think she's on today. She's the team lead there, and she might speak to that during the conversation. But they managed to do actual virtual classes, which I think is a huge win. So despite some of the challenges, there definitely were successes. I feel like I talked really, really fast, but I did leave a slide for some comments and questions. So I'm happy to answer anything that's come up.
That is great. You did great. Really inspiring work, and I know there's been lots of chat in the chat box, a lot around just wanting to see the algorithms in depth. So I might start with that and then go to you, Shauna, for the other questions. So I'm just going to take us back. I know, do you want to walk us through this algorithm a bit, and then maybe we could zoom in. We're going to send the slides out afterwards, so people will have a copy of it. But do you just want to walk us through there? Because I know there was some interest.
Yeah, this first one is the virtual care algorithm for diabetes education centers. And actually, the final document kind of supersedes this, and this is this was our first draft. The last more comprehensive draft is at the end, but this was the first one. So basically, we were saying review the client appointment and determine what type of care was most appropriate. So you're looking at telephone or Zoom, and then simply contacting the client to see if it's appropriate. So is virtual care appropriate for that client, and is it desired and possible for that client? And if yes, simply proceed. This is a really simple algorithm. Go ahead, do it, complete the follow-up, but things like clinical documentation as usual, those things that we were trying to help people think about. And then if it wasn't desired, the no, in the beginning, we were pretty hard. We just said, call back in a couple months. We'll see where we're at. But if it was a priority service, we'd work through that, right? So contact the DEC 1 to 2 months and request an in-person service. And then we ask the clinician to then follow up with the referring provider so that they're aware that that didn't go. But like I said, it came back, no, we need to actually see some people in person, and that's why we had that final algorithm. And
right.
Yeah, and we can share these. That's fine. We can share.
I think folks would be really interested. So maybe in our follow-up email, I'll touch base with you and we could get copies of these. There was also, I think, a question around just elaborating on the Skype soft phone option.
Yeah, and that's not one I have a ton of experience with because we were working so much with Zoom, but we did have folks go home and obviously not wanting to use their cell phones. It makes good sense. So Skype Business has the option to have a telephone, and for Interior Health, we all have Skype Business installed in our computers. So if they're at home with an IH computer, it's there. What they need to do is connect with IMIP, like we would for any other software request, and ask for the Skype telephone option. And then you can call from Skype. You can call from your computer, plug in the number, and off you go.
Perfect. Okay, great. Shauna, do you want to, I think I might be going out of order in questions. Just going to check in with you of the next question in the chat for Melanie.
Yeah, just one from Maya that got sent through. How far in advance to the actual appointment is the Zoom invite sent to the client, and who sends that invite?
Yeah, good questions. I'm not sure how far in advance it is at this point because there was a rapid changeover from our existing appointment to Zoom. So I'd have to actually reach out to our clinics and ask them what they're doing. It would probably depend on the availability of the client as well as the clinician, given what's been going on and if people are being redeployed. What was the second half of that story?
Who sends the invite?
Oh, who sends the invite? Yeah, so it can be the clinician or it can be our administrative staff. So like I said, we were supplying whoever was sending that Zoom account or that Zoom invite with a do not reply account to verify the email address, and then that person could then go ahead and send the Zoom invite. So it could be from the clinician or it could be from clinical staff.
Great, thank you. So I think there are a few more questions that we will take note of and maybe send them your way, Melanie, to answer offline if you're okay with that.
Yeah, absolutely.
Okay, great. And some of it might kind of come up naturally in the next kind of discussion, but I do want to thank you for stepping up and sharing your experience first. Sounds like you guys have come a long way.
That's great. Thank you so much for having us.
Thank you. So, like I said, the next kind of chunk of time, next 20 minutes or so, will be a roundtable discussion. So this gives other health authorities and other individuals a chance to really share their experience with virtual care in diabetes education, successes, challenges, barriers, any learning, any great resources you've come across. So this is the chance. So this is also where we're going to unmute everybody's lines. We do have quite a few folks on, so this is a bit dangerous. Again, your mute button is just right next to your name, so you're going to be unmuted. If you don't have, if you're not the one speaking, I would just suggest that you do mute, or if you have any background noise, and then you can unmute yourself now. Now you have that control to mute and unmute. So Shauna, do you want to go ahead and unmute everyone? Sounds good. There we go. Great. So we'll just give a minute to folks so that they could mute their line, again, just to the right of your name. Most folks are muting themselves. Just give another 30 seconds.
You're obviously on.
Now we get to actually get some lived experience of technology and how to work all these new tools. So Shauna, I will let you there is some background noise, so maybe you can just mute the folks that you think it's coming from. That would be great.
And then if anyone would like to be unmuted and I've muted you, please just do message in the chat to flag that for me or raise your hand.
Yeah, and great suggestion, Sarah. You can also mute if you're calling in. You can do the mute on your phone, and that works just as well. I can hear myself echoing. So anyways, let's get started into our discussion because I know, I think there's going to be lots of discussion and sharing, and I don't want to cut us short. So is there anyone that would like to start us off and add to interior health discussion or share their own experience, their own challenges? Now you can unmute yourself and speak up. You could raise your hand.
Hi.
Hi, Melody.
Hi. I'm a nurse from St. Paul's Hospital at the Diabetes Clinic. We just like Melanie's experience, we kind of had to go straight into the telephone virtual visits and Zoom. The kind of issues that we were having were more that our population, we work with the downtown east side, a lot of elderly patients, was getting them to get emails or work a computer or work their phone. And so Zoom was, we started it very late in the game also because we couldn't use our own desktop computers because it slowed down our whole hospital internet system. So we had to wait to get kind of those Wi-Fi hotspot boxes and then use our laptops that we had, or they were actually requesting us to use our own telephones, and a lot of us just really felt uncomfortable with that. So we didn't get into Zoom till probably end of April, so we're kind of late in the game. And then doing the actual Zoom, we found we had a lot of difficulty before the sessions because people couldn't log on properly, they didn't understand the language of it, and so it was just a lot of technical difficulties that, like, I don't personally know how to do because I've never used it. So it was like, we practiced so many days ahead, over and over, and still in the end of it, it was, we got a very limited amount of people joining, and at the same time, from those limited amount, it got even smaller because people just couldn't get on, and so we just didn't know how to fix it at that point. So it was it was challenging, but we're working on it now. So that's kind of what we've been dealing with. So telephone right now has been our major kind of outlet in talking to patients. But again, same thing, there's a lot of not false information, but like, people will be like, yeah, they're testing fine, blood sugars are great, but really, in hindsight, you see the most recent A1C, and it's not that. It doesn't seem to go with it. So we're just kind of, questioning like how long can this last without having patients come in so that we can kind of see meters. And even if we do, get people to tell us something, are they telling the truth of their numbers, and they can't get into meters, their logbooks. So that's kind of the challenge that we're having. So it's a lot of just seeing if patients are okay and if they're healthy, and, dealing with how they're dealing with COVID. And then another thing is that we're dealing with a lot of patients who just want to talk to someone. So we're spending time just talking to patients who are missing, they have a lot of social isolation, right? And so, they really want to continue talking to us, and yet we're busy, we're fully at capacity for seeing patients. So it's like, we just got to get going, and, kind of wish that there is, I believe 811 has a mental health line that they can call, but I think that's the part that we're having the hardest, is that a lot of these people are just now isolated and lonely, and so they're, you know, and knowing that diabetes is the second leading cause of, you know, kind of complications with COVID, they're very scared to go out. So yeah, that's kind of our issue there. And then the exercise, right? Like, we know that people have to get out and exercise. And so with people not going out because they're so scared, we do see numbers going up.
Thank you for sharing, Melody. Can anyone relate? I'll ask first. Does anyone else want to share their experience and maybe build off of what Melody said, similar or different experiences?
It's Heather Tand. I could share experience from Island Health.
Sure, that would be great.
When we got notice to move to phone and virtual visits early March, we still allowed some urgent in-person visits, and this was left up to the clinician's judgment to decide. And what ended up resulting is probably 98% of our visits are phone and virtual. There is very little in-person visits. It's predominantly urgent pump starts or clients whose anxiety levels with new diagnosis is just not working to do a phone or a virtual visit. So it's been similar to Interior Health, super proud of our teams and their ability to make this happen so quickly. We had been talking about implementing My Virtual Care for about 2 years with our virtual care, our program here at Island Health. And at the beginning of March, we had the opportunity to fast-track implementation, and we have all of our sites across the island using virtual care. We have had glitches with bandwidth. Not able to have more than 3 people on the call at a time. So we are now moving into using Zoom healthcare for group visits. Similar to what others have said, lots of success with the clients. They're so pleased to be getting a connection with a care provider, someone checking in. We're reviewing sick guidelines, and also, you know, just the diabetes distress that people are experiencing with this time. The staff are also similar to Melody. The visits take a lot of time. It's not quicker to do things by phone, and people do want to talk and discuss their challenges. So it is exhausting time, but yeah, super successful with just how quick the transformation has taken place. I did want to mention, though, one thing about the email and consent in Island Health. We were able to get it built into Cerner's registration conversation, where the email is documented, and you just indicate whether or not you've got consent from the client to use that email. We didn't have to send our clients an email and then get a reply from privacy, or if I missed that memo, I'll have to go back and look. But yeah, it's been very busy times, but very proud of all our teams.
Yeah, it definitely shows the agility of teams across the province. This time has definitely shown that. I do want to just touch on the classes, the group visits, and I know Melanie mentioned that as well. Katie, are you on the line, and would you be able to speak to that? Because I know that's been a topic of interest around delivery of virtual group visits or classes.
You bet. Sorry, you'll have to never mind the background noise, because we're also homeschooling.
We're all in the same boat.
Yeah. So yeah, we've done a gestational class, because we've had about I would say 6 to 12 gestational ladies every 2 weeks. So we had to figure out a way that we could get them in quickly and have them seen as effectively as possible. And so we have managed to do one class, and it was actually really successful. We had them pick up a package before the class as well, so we could share our screens within Zoom and go through our teaching materials with them. And it was great because then they also were able to help each other through that class. And we just trialed our first Type 2 class. We normally do our Type 2 classes in 2 classes, and so we condensed it a bit more and used our the On the Road to Diabetes booklet from Fraser Health, which was awesome, to kind of go through with, I think there was 7 or 8 people on the line. So it was great. I mean, there is technical stuff. The technical challenges definitely come up, but overall, there has been lots of good feedback, and I think we really wanted to move in this direction, and sometimes you just have to be forced.
It's true. Yeah, and there's always technical, like as we see today, right? There's always, you have to build in that bit of buffer for technical issues. So we've heard from Interior, Island, Providence. I do want to give, is there anyone from Fraser that wants to share? Or Northern Health?
Calling from Fraser Health.
Hi.
Our first class launching next week, so they'll be sent all the materials today. And our materials that we send them are actually the class videos that we've recorded. So we've made voice recordings for both the nurse and dietitian segments that are now on YouTube. And they're instructed to watch both the dietitian and the nurse segment before each kind of weekly scheduled discussion period that will be offered via Zoom. So instead of doing like all the teaching live in person, they're kind of doing that on their own time before, and then we'll have like a discussion period where we'll review kind of the main points and answer any questions they have. So taking a bit of a different approach. And then for our diabetes and pregnancy clinic, we've actually made a video as well. And this is kind of the clinician on the screen, kind of teaching as they would be in class, both the nurse and the dietitian, and kind of guiding them through our nutrition booklet on each page and going through all the topics. So they'll also be watching that in advance, and then they'll get a follow-up phone call from us individually. So yeah, we haven't tried either yet. So like I said, next week is our first try, so we'll see how it goes.
Wow, that's great. And I know there's probably interest in seeing those videos and seeing how it goes. So thanks for sharing. I do want to remind, so for folks that maybe you can't unmute yourself or you don't feel like talking or you have background noise, feel free to comment or ask a question or share your experience, barriers, challenges, successes, great resources in the chat box. Shauna, I will check in with you. Has there been any questions or any sharing that we want to share verbally?
Yeah, I just unmuted Heather Pert so that she could share. She was muted before. So Heather?
Great. Hi, Heather.
Oh, thank you. And we are another site in Fraser Health White Rock, and we chose to continue on with the diabetes class 1, 2, and 3. So we did our first class 1 last night. And similar to everyone else, yes, there are the technical difficulties and the challenge of feeling like people are participating. Fraser Health has disabled chat for now. However, we feel that the class did go quite well, and we ran it as close to the usual class 1 as we could. And yes, On the Road to Diabetes Health is a great resource to refer to. Thank you.
That's great. Thank you. Anyone, I'll check in with you, Shauna, again. Anyone else wanting to share?
I haven't seen any other messages in the chat, but
okay, no problem. I don't.
No, don't see them either.
Okay, I will.
Rebecca Softy just wrote a message in the chat. Rebecca, I can go and unmute you. Here, there we go. If you wanted to share.
Can you hear me? I just wasn't sure if you'd be able to hear me.
No.
Okay.
Yeah, we can hear you.
Yeah, great. So it's not diabetes specific, but First Nations Health Authority has recently launched a First Nations Virtual Doctor of the Day program, which I think is a huge success for those that are remote or in Indigenous communities. It's too early to share any successes or challenges associated with it, but it's definitely a promising one, and I hope something that we can continue post-COVID for those that have less access. And I also think that we do have at least one representative from one of the mobile diabetes teams. So there are 2 within the province that are servicing First Nations communities, one through Carrier Sekani Family Services and the other through Seabird Island. And I do believe that they've also moved to the virtual platforms as well. So some great successes there.
Great. And can I ask what platform? Is it Zoom or?
That I'm not sure. I'd have to see if one of them would be willing to share. I'm assuming it's probably phone for the majority of the time, given that there's limited connectivity in some communities.
Right. And the Doctor of the Day program, is that?
I think mostly video, but probably also some phone.
Yeah, great. Okay. It's steps towards, you know, everyone's moving towards the same direction. So I think we could go on for sure. I am just conscious of the time, and I know we just booked 60 minutes to kind of get the discussion started. It feels like we're just kind of getting into it, and we're reaching 2:30, so I'm conscious of that. So before we kind of wrap up, I just want to say thank you to everyone that kind of contributed and everyone for tuning in, because like I said, this is just the starting conversation, and there's lots more to share. And as we're hearing, lots is happening right now and next week. So there's lots to be learned and a lot of challenges to arise and a lot of successes to share. So with that, I do want to jump into a poll. So a poll, I guess, Shauna, you have the...
Yeah, I just grabbed the ball. So
great.
I have the polls ready to be launched.
Great. So we're interested in kind of next steps before we wrap up, just around future meeting, exploring kind of if there is appetite to meet again, how often would be good for you guys, and what topics would you be interested in. So on the bottom right-hand side of your screen, a poll should appear. There you go. So I'll just wait maybe a minute. I'll give you guys a minute, and if you want to fill that in, and then we will share our results. Great. Okay, I think we can share results.
It's just closing the poll, waiting a few seconds for...
No problem. Next time I should have music while we fill in the poll.
That's a great idea. 5 seconds remaining. 4, 3, 2, 1, and then I will share the results with attendees.
Great.
There we go.
Great. So good responses. Okay, so we have kind of agreement on there is the interest of getting together again, and a bit of spread on the how often monthly looks good. And then topics we want to cover that we can share later. So I do want to pass it over to Colleen to kind of summarize the conversation today as well as next steps. Colleen?
Great. Thank you so much, Raman. And thanks to everyone for your engagement on today's call. Really appreciate hearing your energy. And we certainly heard today about that huge growth in virtual care in response to COVID-19. And I love somebody had made the statement, it's difficult to move in this direction, but sometimes you have to be forced. And I thought it was fascinating to hear that. And so to date, most of you are using phones or video conference. And we had the opportunity to hear today from Melanie and IH's journey and how they've responded. And Melanie's kindly agreed to share the algorithm. She said to me that they're waiting for the final endorsement, but once they get those guidelines approved, we'll make sure we share them with you all. And we can actually also build a repository on the Council's website so that you can access these resources. And I think it's maybe the first of many resources we're hearing about some pretty amazing opportunities. So it sounds like there's some agreement on continuing to meet. There was a resounding yes to absolutely and connecting monthly. And I think those meetings can be, we really hope those meetings can be an opportunity for all of us to come together to build on this incredible work that's happening and to learn from the successes and opportunities. We heard some of the challenges today around bandwidth. I live in a remote area, so I can totally feel for that one. And the successes, things like insulin starts on the phone, recorded
I'm so
video.
sorry, Colleen.
Oh, no.
Folks are having a little bit of a hard time hearing you, and I want them to be able to hear you. So
no.
maybe just hold. Yeah.
Yeah, I'm going to go use my handset. I'll be right back then. I'll just won't be able to.
Okay.
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 I'm so sorry. Can you hear me now?
Yeah, that's way better.
Oh,
thank you.
Wonderful. Yeah, so I think, should I just start from the beginning? I don't know how much people missed.
I think maybe start from the beginning. There were a
okay.
few folks that...
Thanks very much, everyone.
Yeah,
Forgive me. It appears that my headset now officially has to go in the garbage today. But just to summarize what I was saying is that you can hear from today there's been just a huge growth in virtual care in response to COVID-19. And, we really did hear the comment that somebody said about it's difficult to move in this direction, but sometimes you have to be forced. And the current situation has really forced this movement, and it's incredible to hear some of the work that's happening to date. Many of you are using the phone or video conference right now. We heard from Melanie share IH's journey and how they've responded to this work and the incredible algorithm they've pulled together to help guide that process. And Melanie indicated that they're just waiting for final endorsement on that, and they will get these guidelines back to us, and we'll make sure we share them with all of you and also get them up on our website. And I think we really heard a resounding yes about continuing to meet, and it looks like on a monthly basis. And I think in the interim, there's really an opportunity to learn from and build on the incredible work that's happening across the province. So some of the successes that people have had around insulin starts on the phone or recorded videos to deliver main content, so much incredible work happening. And there's also real opportunities for improvement, too, some of the challenges we see with bandwidth. But we think there's a chance for us all to come together, to really share solutions and learning, and it's, I think, a chance for us to even build a central repository of some of these resources. So as you kind of go back to your work today and you think about some of the resources that you've tapped into, if you're willing to share them, please send them off to the diabetes email address that was used for this appointment, and we can actually start kind of curating and collating that work. Maybe we'll just go to the last slide on the networks, and I'll wrap things up now, knowing the time. And so, really, the evidence is really clear that we can accomplish so much more together than, when we actually can work through things like networks. And so we can accomplish more together than we can on our own. And so the IHSTS and the Council are partnering to develop a provincial network, really looking at advancing type 2 diabetes in the province and the care around type 2 diabetes in the province. And we're really a team of very passionate change makers that are focused on improving the prevention, management, and some of the outcomes relating to people living with type 2 diabetes. And so sessions like this are some of the things we're really going to be starting to support. We really want to provide the opportunities and a space for people to be able to come together and learn and share with each other. And so if you haven't already done so, we'd really like to invite you to join the network. Shauna was going to pop the link in the chat box today. But by doing so, if you sign up and join the network, you'll ensure you receive sort of some of the up-to-date information of other activities the network might be doing, resources and ongoing news about events like today. But just as a main next step, we will move forward with planning a subsequent meeting. We heard loudly from you that you want that. We will plan for those to be monthly at this stage in the game, and we're going to start curating some of these incredible resources that we're hearing through the system. And we'll start with Melanie's resource she shared today and invite others to share the resources so we can start kind of sharing them broadly with everyone across the province. So thanks so much, everyone. Raman, I'll hand it back to you, and apologies for my phone issues.
No, that was great. Thank you so much, everyone. I just want to say thanks for joining. I know we're at 2:30. These are incredible times, and there's definitely incredible work happening across the province. So thank you for joining us and sharing, and we're looking forward to connecting again. A poll is going to come up on your right-hand side again, just around how this session was for you and how we can improve future sessions, especially now that we hope that we will be meeting on a regular basis. So please take a few seconds to answer those questions. We'll leave it up as you guys sign out, and a follow-up email will be going out with a recording of this session and a summary, so feel free to pass along to your colleagues that you think may be interested. And that is it. If there's anything else, you can reach out to us at diabetes@bcpsqc.ca. Thank you again for joining. Bye, everyone.